So we are here in Cancun, Mexico at the first inaugural AdvocaSea. Super pumped to have everybody here. We have so many people in the room right now. I think collectively we haven't taken a number, but they're touching about 7 million patient lives, if not more. And I think that's an underestimate. We're actually going around and tallying. What's really cool is we are actually going to come out with some actionable solutions. And I think the first thing that we all said was, what can we come out with by Monday? Which, what, we're at Friday right now, right? It's Friday. And what do we have? What are short term, intermediate, and long term? And I think collectively, everybody said, we're kind of tired about talking about these things, or we keep hearing regurgitation of these barriers. And we got such smart minds in the room, from the payer background, from the specialty pharmacy, from the biologic coordinators, medication access coordinators, rare disease mothers in there who could launch a drug company, seriously. And so we're super pumped. I'm excited to be here. I'm so thankful that there are so many connections. And I'm looking at you, field reimbursement managers, and I'm looking at you, people who walked into Melissa Page's office in the basement of University of Virginia Health System. And I didn't know what a field reimbursement manager was. And I didn't know what a start form was. If it wasn't for you, we wouldn't have this. So I want you to know that you making these connections with the other people who care, who have a personal story behind it, which we all do, that is the greatest thing that you can do. And I can't tell you how thankful I am for the past 5 years, 6 years, 7 years, whatever we've been doing this, of what we're able to do with some actionable insights and tools and resources on there. So I'm pumped. Elizabeth's over here probably taking a work call with one of her physicians that she's still doing her day job. And just, I'm excited for everybody just to follow, to like, to support. If you have any questions, or please comment on some of these barriers. But we are excited to bring kind of the information and the key takeaways to people such as yourself in an industry. Like, you guys have the budgets, and you will be able to help kind of steer on how to spend those appropriate, more patient facing resources, better hub utilization. We're talking about the importance of the start form and what you get. And one person in the room said, "What is a hub?" If they're saying what is a hub, or we're using these terms on there, uh, that's one of the reasons why they're not using your hub. They don't even know what a hub is, or maybe we're using the wrong words. But I'm looking right here through the glass, and you can't see. There are some great discussions happening. And I think from this, I said, hey, let Melissa and Elizabeth be the voice of all of you guys together. Let's collectively come up with like the top 5 barriers right now of what we're doing. So we're super pumped. I'm super excited to be here. It's been a lot of work behind this, but it's not even been hard work. It's been passionate work. And we get to kind of throw it out there of, hey, here's what we're thinking. What are you thinking? So thank you. Thank you for everybody who's been so supportive of Elizabeth and I and all of our initiatives. And our next conference is coming up to dive into every therapeutic area, Specialty Summit USA. It's in May in Nashville. And then we've got the Healthcare Advocate Summit later. So excited. The Specialty Summit USA, think of us kind of going one step up from the patient, right? So Healthcare Advocate Summit is those who are supporting those patients. Now Specialty Summit USA. Industry, this is for you. We found the voices. We found the thousands of healthcare workers that we have broken down into every therapeutic area, who's doing the start form, who's doing the re-enrollment, and bringing those voices to you so you can come for 24 hours. We will make it worth it. And just honest conversation. And it's not a dialogue. Or it is a dialogue, not a monologue on there. So excited. And anybody who has any questions, slide into our DMs. So thanks.